Hi, I'm Dr. Amy Pollak, a cardiologist from Mayo Clinic in Jacksonville, Florida. We're talking today about women and heart disease. Did you know that heart disease is the #1 killer of women? And 90% of women have one or more risk factor for heart disease or stroke. February is Heart Health Awareness Month, and the American Heart Association is encouraging women to take a first step in preventing heart disease by scheduling a Well Woman visit for their heart health. So what do we do in a Well Woman visit for heart health? We're hoping to get a head-to-toe checkup of your heart and blood vessels. This is really a 1-hour investment in your health and in your future health. Part of what we look at are things like blood pressure, measuring your cholesterol, looking at your weight, body mass index, and then a physical exam to see if we're able to detect any signs of heart disease. Sometimes we can determine if there's cholesterol buildup in the carotid arteries or in the blood vessels to the legs. The American Heart Association estimates that 80% of all cardiovascular disease can be prevented. And certainly we're all in agreement that it's way better to prevent a disease than to treat it after it really becomes a problem. As I mentioned, we'll do some tests such as a cholesterol screening. Sometimes we do other evaluations like an EKG to help assess what your heart health is. And occasionally we need to do a stress test or other heart testing. I hope that you'll consider having a Well Woman check. If you don't get it scheduled in February, aim to get it scheduled sometime this spring, and that way together we can really take important steps to help lower the risk of heart disease for women.